Thank you for joining us on Coffee Break, brought to you by the Middle Alabama Area Agency on Aging, or M4A. M4A is a part of a network of 13 area agencies on aging that cover all 67 counties across the state. We are located in Alabaster, and we cover Blount, Chilton, Shelby, St. Clair, and Walker counties. We would love to find out how we can help your family today. For previous episodes of Coffee Break, feel free to check out our YouTube channel. All right, I think we're going to go ahead and kick things off. We'll give if you join us late, this is being streamed on our Facebook channel, so you can always go back and watch the live feed. And then we also record these, so we will be putting this on our YouTube channel and then taking that recording and putting it on social media as well, the cleaned version of it. So if this is your first time joining us for Coffee Break, we really appreciate you taking the time to join in. And really, this is an initiative that's been going on since the pandemic first kicked off. And really, the idea behind the program is to provide family caregivers with an opportunity to take a brief moment of respite while also learning something educational, whether it be about a local resource or a hobby or whatever we find to be a relevant topic for the month. So for this month, we are celebrating National Family Caregivers Month, and as well as Alzheimer's Disease Awareness Month. And this is session 27. And so we'll go ahead and kick things off. Again, we are streaming this live on Facebook. This is a webinar format. So if you're attending, especially for those who are in our Zoom chat or Zoom platform, you won't be able to ask your question out loud, but you can always drop it in the chat section as well as the Q&A, and we'll make sure that we get the question answered for you. For those that are in the social media world, feel free to drop a comment either during or after the Facebook video, and we can make sure that we get you an answer. Before we kick things off, this is especially important for those who are in the social media world, Facebook, YouTube, etc. Participation, we do want to make sure we make a disclaimer, and participation in this online group session is voluntary. Individuals who choose to participate in this group acknowledge and agree that they are not required to share personal information with the group, but may voluntarily share aspects of their protected health information with the group. Protected health information is specifically defined in the Health Insurance Portability and Accountability Act of 1996, also known as HIPAA. This includes, but is not limited to, your name, address, and specific medical conditions. Should you decide to voluntarily share protected information about yourself or your condition, you're responsible for that decision, and the Middle Alabama Area Agency on Aging, or M4A, is not responsible for the disclosure or any redisclosures that may occur as a result. Additionally, any of the suggestions or recommendations presented during this meeting are not meant to diagnose nor treat disease. This meeting is intended for educational purposes only. Please consult with your own medical doctor for any concerns regarding diagnosis and/or treatment. As usual, again, if this is the first time that you've joined us, the Coffee Break is hosted by two of the in-house programs at M4A. We'll go over a little more about who M4A is towards the end if we have a few minutes, but it is brought to you by two of the in-house programs that we provide through M4A, and that is the PANDA Project, which is providing Alzheimer's and dementia assistance, and the Alabama Cares Caregiver Support Program. This is, again, session 27. And for those, this here is basically a banner that we've been promoting on our Facebook page. We put these up whenever we're hosting events. So this would be something that would be kind of floating around social media, but especially on our M4A page under the events tab. So feel free to check those out kind of in the future as we plan more events. Now, this session of Coffee Break is a little different than the last. We did want to pay close attention to the audience that we're serving, and that is typically family caregivers. We were able to partner with one of our longtime partners, 101 Mobility, and they were gracious enough to provide us with a gift for a family caregiver this month to make sure that we, show our appreciation, because we know it's a very important and very tough often job to do. So we want to make sure that we definitely show appreciation by providing you with a gift during this month. And 101 Mobility of Alabama is a locally owned and operated and backed by a nationally respected brand with over a decade of experience. They're located in Birmingham, and you can reach them there at the local number or on their website at 101mobility.com/Alabama. Now, obviously, due to HIPAA, we are not able to show participants and who is a part of this program. But what we will do is take anyone, especially those who are viewing in Facebook right now. If you're wanting to participate in this, make sure, contact us, whether that's by sending us a Facebook message or commenting on the video to let us know a way to get in contact with you so that we can put you in the drawing, as well as those that are here with us in Zoom. We're going to run a report and kind of get everyone who's been in the meeting. We're going to kind of enter your names there into a drawing and do a random drawing to reach out to the winner. Now, if you don't respond, or if we're unable to get a hold of you, we will have to redraw to make sure that we get this present or gift given out to another participant. So make sure you keep your eyes on your email, on your phone, to make sure that we can get a response and get these to you. Today's guest speaker is a longtime advocate for our mission, as well as a longtime partner. We always love when Ms. Miller comes on and talks about the wealth of knowledge that she provides about her organization and what they provide and have provided for many, many years. She's the executive director of Alzheimer's of Central Alabama. We like to call them ACA, and they're located in Birmingham. And Ms. Miller, I'm going to kind of pass it on to you and let you introduce yourself and give us a great presentation.
Good. Thank you, Jeremy. It's a real pleasure and honor to be with you here today. And if you'll move to the first slide. This is just to provide our contact information and to alert you to the fact that Alzheimer's of Central Alabama is celebrating our 30th anniversary this year, which is a real feat. I feel like I have grown up with this organization. And as Jeremy mentioned, November is National Alzheimer's Awareness Month, and this is really in honor of President Ronald Reagan. He made his announcement in a formal letter to the country in November of 1994, disclosing his own diagnosis as a way to bring Alzheimer's into the open so that it could become the disease that it is now, one where we can openly talk about it and discuss, where embarrassment over symptoms is more limited. We're seeing changes in things like dementia-friendly communities, dementia-friendly businesses who want and to cater to the needs of people with dementia, people living with dementia, and their caregivers. 30 years ago, when we started this organization, there were about 52,000 Alabamians with Alzheimer's, and today there's 96,000, and we're expecting a 17% increase over the next 4 years. Next slide, Jeremy.
And so, Miller, I did want to add, if you want to put that into perspective on the age of how long Alzheimer's of Central Alabama has been doing this, I was 3 when they started. So that kind of gives you a good idea. They've been doing this for a long time.
Me too, Jeremy. Me too. No, actually, I just had my 60th birthday, so I've been doing this half my life for real. And of course, I was a family caregiver before that. But the one question that I'm asked most often is, what's the difference between Alzheimer's and dementia? So I always think that's a good place to start, because I'm sure some of you out there are wondering that as well. Dementia is considered an umbrella term, and lots of different things can cause dementia. Alzheimer's is the most common. So dementia is like describing your symptoms. Alzheimer's is like the diagnosis that you've received. 60 to 80% of dementia cases are Alzheimer's. But what we find upon autopsy is that many people have a mixed dementia. Also, during these 30 years I've been doing this, I spent 20 years working at UAB, and I was the education director for the Alzheimer's Disease Research Center. And one of my jobs was to recruit people to participate in the brain autopsy program. And what we found with those autopsies here in Birmingham at UAB and also across the country is that most people didn't just have Alzheimer's disease. Most people also would have had Alzheimer's disease and maybe small strokes or TIAs, or they might have Alzheimer's and Lewy body disease or frontal temporal dementia. And so we really see mixed causes to dementia when you look at things on a cellular level. I think it's also important to note that 45% of people who are living with Alzheimer's disease are never told their diagnosis. Now, we used to say, well, they don't really have any awareness and they don't really, they really wouldn't understand their diagnosis. But I think for most people, and particularly now that people are getting diagnosed earlier and younger, it is important to be open and frank and to have that conversation. Many years ago, one of my dearest caregivers, I call her a caregiving minister because of how much she taught me and how much she ministered to me. But after her mother died, her mother had lived with her for many years and she was going through her things. She picked up her mother's Bible, and inside the Bible was a pamphlet about Alzheimer's disease. And she was so surprised because her and her mother had never had a conversation about her mother's diagnosis. But that led her to believe that her mother had been very aware of what had been going on, at least, at some point. And she really missed an opportunity to have a frank discussion with her. And I think one of the things that you want to do as part of that frank discussion is to be sure that you have let your loved one know that you're going to be there for them, that they don't have to worry, that they don't have to have anxiety, that you're going to be there for them and remember for them. Because that's really what our job is as a caregiver. Our job is to remember what they forget. It's not to cajole or shame them into trying to remember. It's just to be there for them. Next slide, Jeremy. Now, every 65 seconds, someone will develop Alzheimer's disease in America. And so it's a very common problem. 1 in 9 over the age of 65 will have Alzheimer's or another form of dementia. A third of those over age 85. 2/3 of people living with Alzheimer's are women. Of those who reach their 71st birthday, 16% of women will have Alzheimer's as opposed to 11% of men. We know that by the year 2050, 153 million people worldwide will have Alzheimer's disease, and that is half of today's U.S. population. So just imagine that. It's going to require a lot of careful planning to make our healthcare resources able to take care of that many people, because people with Alzheimer's disease, it's an expensive illness, it's a long-term illness, and they do require a great deal of care. Next slide. What are the warning signs for Alzheimer's? In my life, because I've had 3 family members with Alzheimer's, and because of my age, every time I forget something, I worry a little bit. So what are those warning signs? Well, we all know that it's memory loss, but it's memory loss that disrupts daily life. It's not just the forgetting of a few little things here or there. I know one caregiver told me that her mother had always been very involved in the altar guild at her church, and one of her jobs at Easter was to order the Easter lilies, and she forgot that very important duty. So you can imagine how disruptive that was, and of course, for her it was very embarrassing as well. Challenges in planning and problem solving, or difficulty completing tasks that should be familiar. Those are things like preparing a meal or balancing the checkbook. With Thanksgiving coming up, that might be a time where things are really revealed because you're around family members more. I know for my own mother, it became very apparent to me when preparing a meal, setting the table, making sure that all of the dishes were ready to eat at the same time just became too challenging for her, and all of the joy that she had previously gotten from entertaining just was gone. And that's when it's time for the family to realize that and to make a shift. And we did. We started swapping back and forth, and we'd go to my sister's house or my house. Confusion with time and place. I don't know about you, but I have found myself confused over time and place since the beginning of COVID. And I find that all the time. We're talking about somebody that we knew and how long we'd known them, and it's been 5 years. Well, I would have thought we'd just known them a couple of years. It was that kind of thing. But for our Alzheimer patients, it's more of the turning up at church on the wrong day, missing doctor's appointments, not being able to name the season, the month, the year. Trouble understanding visual images and spatial relationships. Part of the very standard mental status examination to begin to diagnose someone with Alzheimer's is to ask them to draw the face of a clock, because that's very difficult for people who are having spatial problems with spatial relationships and getting the numbers in the right place. Next slide. New problems with words and speaking or writing. I always tell people it's when you notice someone is having trouble speaking or getting the right word out, be very aware that they are also probably having problems with comprehension, and they may not be comprehending the things that you're saying clearly, and they may not be able to understand the thread of a conversation because the words come at them too quickly. Misplacing things, I think we're all familiar with. Decreased or poor judgment. One of my caregivers' husbands sold a piece of property for way less than the piece of property was worth. He just did not exercise good judgment, and the deal was made before she realized it. And so that's why it's so important to safeguard your loved one's assets and make certain that you have taken care of the legal challenges that you need to face with Alzheimer's and getting power of attorney and being in charge of their assets and resources. Withdrawing from work and social activities, and changes in mood and personality, including apathy and depression. I always tell caregivers, when you think about these changes in mood and personality, sometimes it's someone who has who has a personality change. Maybe they've always been kind, and now they're real snappy, and they say things that are unkind. And that's one thing to deal with, but another is to deal with people who have what I call a personality exaggeration. Maybe they weren't really all that nice to be around ever, but now it's much worse. And I think that's difficult for families. Say if you're a daughter and you feel like your mother has always been critical of you, and now as you're trying to care for her, she becomes more and more critical. I think that becomes difficult sometimes for a family caregiver to understand where their personality ends and a disease process begins. One of the things that we tell our families is once someone has a diagnosis of Alzheimer's, their behavior is forgiven, because they have got a disease that impacts the words that they choose to say, the way that they act. And so that we really have to be very careful in our approach and how we respond to them. Next slide. Sometimes a picture is worth 1,000 words. These are brain pictures from an autopsies that were performed at UAB by Dr. Richard Powers. He was a neuropathologist and psychiatrist and has worked in the field of Alzheimer's disease in numerous capacities with the state over the years. But he put together what were called the brain books to show people why there were changes in behavior, because you can imagine as the cells in the brain begin to die, that the functions are impaired, and the function that those cells served is lost. Next slide. Now, the disease course on average from diagnosis to death is about 8 to 10 years. Most people take a couple of years from when they notice symptoms to when they actually get diagnosed, because in the beginning, things are very insidious, and you're not really sure if the changes, is that something to worry about or not. It's when those changes become more persistent that you begin to see a pattern. There are 3 things I want to point out about dangers at home, and these are guns, cars, and medications, managing their pills. Those are things that we really have to think about, and think about what the safety measures. As far as car driving, I've got a dear caregiver who they sold her husband's car. She thought that that was going to solve the problem of him wanting to drive, but it didn't. It only deepened his desire to get a new truck. And bless her, in her struggle to help him understand that he can no longer drive, she took great lengths and came up with a flow chart and explained to him, well, you've got eye problems and the finances and the this and the that of not being able to drive in a flow chart. Well, of course, that did not work. So it's important for us to know, I think, now as we're healthy and we're still driving, that all of us, studies have found, outlive our ability to drive safely by 6 to 10 years. So people who think that they can that they can continue to safely drive may not be as safe as they thought. And those are people, that includes people who don't have dementia or Alzheimer's. So driving is a really big, huge issue. Another thing that we have to consider are what I call the 3 Ds of loss, and that's dignity, dependency, and it gets right back to the other one, driver's license. It's losing that driver's license and what that means for families. So patients progress from needing supervision. Many still live alone, and that might be safe as long as they've got a family member that comes and checks on them regularly. But custodial care is the stage where people spend the most time. This is when they need 24-hour-a-day supervision. It may not be medical needs that they have, but they're not safe to be left alone. They're not safe to manage their own medications. And of course, in the latter stages of the disease, patients need nursing care, but that's not to say that nurses are providing it, because still most people are living at home and cared for by a family member. Next slide. One of the things that one of my coworkers says all the time is when someone has got Alzheimer's disease, it's all about rainbows and unicorns. Rainbows and unicorns. Remember that. It's better to be kind than correct. They may say something that's not true, and it does not matter. You just go right on with things. Rationalizing and reasoning, like creating a flow chart, don't work, and it's better to try to redirect. And that can be really challenging. And I think it came up in my support group yesterday where, sometimes the best advice I can give someone is, you've got to learn to be more patient. I mean, that is the advice, because you can't change someone with Alzheimer's disease. You can only change yourself and how you respond to it. And that's what's really most important. Next slide. Okay, I'm going to switch gears a little bit now and talk about sort of the direction that Alzheimer's is going in. And it's really one that I wouldn't have ever thought of 30 years ago, but that's in the area of prevention. And so before I really talk about that, I want to, kind of get genetics out of the way, because genetics certainly does play a role in Alzheimer's disease. Dr. Powers, who made those pictures, the brain pictures, used to say that we had a 1/3, 1/3, 1/3 risk of developing Alzheimer's. 1/3 is genetics, and 1/3 is our lifestyle choices. And that's what we can affect. And then 1/3 is just bad luck. Renee Harmon is a local author. She's written a book about caring for her husband, Harvey, who had early onset Alzheimer's disease. And he maintained a very healthy diet and was a marathon runner. They checked his genes. He had genetic testing done, and that was not the issue either. So for him, we can say, well, he's in that category of 1/3 bad luck. And I don't say that in a flip way. It's because it's been a very challenging journey for their family, but one they've turned into something very positive with Renee's book and all the good work that she does in the community. So everyone has 2 copies of the ApoE gene. The ApoE4 is the defective form of the gene. And if you've got 1 copy, that gives you a 12% greater chance of Alzheimer's. And if you've got 2 copies, it increases your risk by 65% or greater. Now, that's the majority of the genetic connection with Alzheimer's. But research has found up to 84 other genes that are implicated in Alzheimer's. And in some of those, it can be a very specific gene. And if you have that specific gene, you will definitely get Alzheimer's. There's several families that fall into that category here in Alabama. Some of them have been studied and have been part of a genetic study at UAB. One of those families is from Thomasville, the Thomasville area. And I was speaking with one of the family members, and she said that she had gotten her results, and she kept them in a sealed envelope, and she was not going to open that envelope until she retired. And that was her decision. She said her brother, on the other hand, had opened his envelope. He really wanted to know. He was a younger brother, and he did not carry the gene, so he will not get Alzheimer's disease. She said, but his lifestyle choices are what are putting him at risk. So that's what we're going to focus on a little bit, are some of those lifestyle choices. Next slide. So emerging research is showing that maybe up to 40% of Alzheimer cases can be prevented. And if we could delay the onset by 5 years, we could cut the incidence in half. There is a new study that is taking place, recruiting people to participate in an Alzheimer's vaccine. This is a vaccine that is given to people in the early stages of the disease and hopefully helps halt the processes in the brain that lead to Alzheimer's. We don't know if it's going to do that yet, but they're recruiting people for that study. And they interviewed a man today, and what he said was, what is really profound, he said, for where I am right now, if somebody told me I could have a shot and I could have 1 or 2 more good years, that would mean all the world to me. So, that's what we're trying to do, is push Alzheimer's back in the life cycle. So research into prevention has been a real game changer. Next slide. And what we know is that lifestyle can trump genetics. And 80% of Americans want to reduce their dementia risk, but only 25% know what the risk factors are. Next slide. Now, the first thing that came out that gave us any indication that we could be in charge of our own brain health was a campaign about heart health. And they found that people who led a heart-healthy lifestyle were at reduced risk for developing Alzheimer's disease. And we all know the things that we're supposed to do for heart health. It's just been a really, I guess, the best public health campaign ever. We know that we're supposed to exercise, that we're supposed to watch our cholesterol, and we know that it's important to monitor for diabetes. I mean, all of these things, blood pressure, that are important for our heart health are also important for brain health. Next slide. And sort of the next thing that came out was that abdominal obesity, abdominal weight, impacts your brain health. And males should have a waist that's no more than 40 inches, and females should have a waist that's no more than 35 inches. Now, we're talking about an average person. You'd make adjustments, depending on body type and size. But I got some yarn and I cut it in pieces, blue pieces that were 40 inches and pink pieces that were 35. And I used to pass those out when I would do talks. And I realized that wasn't the best tool to use, because yarn's a little bit stretchy and people were not being as honest with their actual waist size. So if you really want to know your waist size and want to monitor that, you need to get a tape measure, I guess is the rule there. Next slide. These statistics came out from UAB. And so when it comes to heart health, Alabama's not doing a good job. And what that means is when it comes to brain health, Alabama is not doing a good job. And, Alabama has the 3rd highest death rate from Alzheimer's disease of any state. So these risk factors for our heart health are impacting our brain health as well. Next slide. And according to the CDC, 30% of Alabamians are physically inactive. And so that's a real problem for us as well. We need to get moving as a state. Next slide. I put out an email every week on Friday, and if that's something that you're interested in, please get our contact information at the end and let us know. But part of that email is I go through all the information that has come out that week. What's new? What's in research? What's going on? And it's interesting to me how many of the things that come out about Alzheimer's are this puts us at risk, this puts us at risk, this puts us at risk. So it's a lot of studies on causation and prevention. And you can see some of these things that are listed up here are things that we can do something about, and some are things that perhaps we're unable to do something about. Take that first one, head trauma. You know, a few years ago, there was Iran fired on a US base in Iraq. And it was they used a lot of bombs. There was a lot of firepower. And it first came out when it was reported, and it said there were no injuries. And then a couple of days later, it said, oh, no, there were 64 people who suffered head trauma from the sheer force of the blast. And then that number increased to 109. I saw something on TV just last week where they were interviewing some of those soldiers who've now returned who are having symptoms of like Alzheimer's, where they're having memory loss, where they have headaches and other problems. So head trauma can have a real impact. Another one that's not up here, but is receiving a lot of attention is PTSD, which also puts our veterans at risk. Childhood trauma, sexual trauma. These are all things that you don't think about being linked to dementia, but studies are showing that they are. Next slide. And social isolation, you know, and this is a problem for us, particularly during COVID, when many people have seriously been socially isolated. And it presents a 50% increased risk for dementia and other serious medical conditions, like a 29% increase in heart disease and a 32% increase in stroke. So bringing people together, finding ways to safely engage is more important than ever. Next slide. Now, the Lancet Commission came out in 2017 with a list of risk factors. They had 9 risk factors, and in 2019 they increased the list to 12 risk factors. And again, if we could mitigate or delay the symptoms of Alzheimer's disease, we could prevent 2 in 5 dementia cases worldwide. Next slide. Now, I think this is a shocker, that hearing loss in midlife is the thing that puts us at greatest risk for developing Alzheimer's disease. Hearing loss. You know, as we've debated these infrastructure bills, you know, there's been a great deal of debate about do we include dental and vision and hearing for people on Medicare, and oh, we so need hearing care for people on Medicare, because this will have a direct impact on the number of people who go on to develop dementia. And I suppose that hearing loss is also linked to that social isolation that comes from people that have hearing loss. So really important to think about. A lack of formal schooling in early life. You know, that's something that we can't necessarily change for someone. We know that you know, a lack of formal education also perhaps means someone will have a lower income and they will have fewer opportunities. But, you know, it's important to note that lifelong learning does protect the brain. Lifelong learning is really important. And I hear the physicians down at UAB say, you know, it's not just great if you read a book. It's great if you read a book and you join a book club and you talk about that book, because that's where the protection comes from your brain. Smoking, 14% of cases worldwide of Alzheimer's disease are linked to smoking, which causes oxidative stress on the blood vessels in the brain. Depression later in life, this worries me tremendously because we know that 30% of our caregivers are at risk for depression. And so I think that's something we need to be very aware of and mindful of. We've talked about head trauma. Next slide. Air pollution. Now, the air pollution, this includes car emissions, power plants, and fires. And I mentioned fires. I have a brother that lives in Colorado, and in the summer when they have all those fires, you just wouldn't believe how bad it is to live with such poor air quality. That's something we really haven't experienced in this part of the country. But your exposure to pollution can increase the number of plaques that you have in your brain by up to 10%. High blood pressure, of course, we've already talked about, and physical inactivity. Obesity. We know that Alabama is ranked 46 in obesity, and excessive alcohol consumption. And that's become a real pandemic issue for people who were sitting at home, isolated, and consuming a little bit more alcohol than they should during the pandemic. Next slide. These came out of the Cleveland Clinic, the 6 pillars to reducing dementia risk. And there's several constructs like this that give us lists of things to do, and they're all pretty similar. But of course, physical exercise is important. I'm going to talk more about food and nutrition. Medical health. Now, this is controlling for our medical risk factors, and those would be the things that we've already talked about, like cholesterol, blood pressure, diabetes, and now we know we need to add hearing to that list. Sleep and relaxation. Sleep is the most important 8 hours of the day, and is really important for us to have a good regimen and good sleep hygiene so that we maintain the proper balance of sleep. Mental fitness, we know that your mind is a use it or lose it organ. And of course, we've talked about social interaction and staying connected. Next slide. Now, Christine Locken is a neuropsychologist at UAB, and she came up with this construct. And ACA, this organization, helped her create some focus groups that looked at these things in ways that people could change, and to see if that actually improved their dementia. Now, on her list, the one that I think is most important that's not on the other list is toxin removal. Now, the EWG work group, that's EWG.org. That is a website that you can go to, and you can find out more about the products that you use, the food that you consume, and whether or not it contains any chemicals that might be a danger. For example, you could see if your deodorant is good for you, if the lipstick that you use is good for you. And I think that's really good. There's another website called Think Dirty, and it does a similar thing where you can find out if you are using brain healthy products. And I think that that's really important. I'm sure most of us do. This information from Christine is available on ACA's website, and I'll give our website at the end. So again, I want to focus on 2 things that are really most important. If we can get the next slide. And that is sleep. It is essential for all aspects of health, and it is amazing how many people do not have good sleep at night. 1/3 of American adults suffer from sleep apnea, which leads to a buildup of the beta amyloid plaques in the hippocampus. What we know about sleep is that it creates almost like waves through the brain, and it helps wash away the toxins that the brain has produced. Go to the next slide. One of the things that we know about our brain is that it weighs 2% of our body weight, but it consumes 20% of the fuel. And because of that high consumption of fuel, the brain has got a lot of trash, a lot of byproducts, and sleep is where the trash is taken out. So that's why we need to really think about maintaining good sleep hygiene, as I said, and going to bed at the same time every night, disconnecting the TV on our computers, for an hour or so before bed, and really getting into a relaxing ritual can be helpful. But the brain, as I said, is an energy hog, and Popeye shouldn't eat spinach to get strong. He should eat spinach to be smart. The next slide, please. Brain supplements. I just have to throw this in here because there's no clear evidence that they're effective. You can hardly turn on the television without seeing commercials for the brain health supplements. Lots of people are spending lots of money on them. The physicians at UAB say they probably won't hurt you, but they're probably not going to help you either. So it might be better to save that money and to put that towards buying more fruits and vegetables, honestly. Next slide. Maintaining proper glucose metabolism is really important. And if this is a problem for you, consider purchasing a glucose blood monitor. What we know is that smoking is to the lungs what fat is to the heart, what sugar is to the brain. So the things that you can do to limit your sugar intake are really important. And one of them, one of the easiest tips for many of us is to reduce the number of calories that you consume in what you drink. And the way to do that is to drink more water and less of anything else. Next slide. A Mediterranean style diet has been shown to have the most benefit for cognitive performance. So this is vegetables, particularly leafy greens, fruits, soy, whole grains, green and black tea. And you are supposed to watch out for what is called the SAD diet. The SAD diet is the standard American diet. It is the opposite of the Mediterranean diet. It includes a lot of sweets and processed foods, red meat, butter, and margarine. Those are the things that we tend to gravitate for, and those are the things that do not benefit our brain. So I want to just give you a few of the next slide, the power brain foods that I think are so important for us to at least be aware of, because I can look at this list and I can think of a snack I could consume this afternoon, and it would be tasty and something I would enjoy, and it would also benefit my brain. And I could do that instead of a bag of chips, and think where I might be. So berries are rich in antioxidants. Nuts, and I'm not talking about peanuts. Peanuts are not included here. We're mainly talking walnuts, but they're high in vitamin E. Fatty fish is salmon and mackerel. These are fish that are high in omega-3. We want to have eggs, particularly the yolks, because they're high in a chemical called choline that is good for brain health. Pumpkin seeds, this is a good time of year to get pumpkin seeds because that helps with our communication skills and helps the cells in the brain communicate better. Coffee is good for concentration, mood, and energy, although there have been some studies that show that people who drink 6 or more cups of coffee a day are actually at increased risk for dementia. So like everything, I guess we're talking about moderation. Green tea has been shown to reduce depression and improves calmness, memory, and attention. Oranges, which have vitamin C, are good for mood and memory and protect against stroke. Turmeric is the chemical. It's kind of a chemical. It's the it's orange in color. It's the spice that's used in many Indian dishes. And dark chocolate is an anti-inflammatory and high in antioxidants and can help reduce depression. So think about those benefits there, and there's enough reasons to maybe reach for something a little bit different when it comes to preparing our meals or having a snack. Now I'm going to switch gears again, and I'm going to use these last few minutes to talk about this organization, Alzheimer's of Central Alabama. As I said, we are a local organization, and that's important to note. Because when you call us, you don't go through a 1-800 number. You go right here and you get someone who's local, who knows the answers to questions about local resources. As I said, we've been here for 30 years and we serve the 21 counties across Central Alabama. Next slide. We provide, as I said, the telephone helpline, support groups that we do on Zoom. I know some support groups are beginning to go back to meeting in person. I don't know what we're going to do about that. I'm just not making a decision. And the reason is because with Zoom support groups, I've got people from all over. We've got people in Chattanooga, someone in Memphis. We got people in Gadsden. I mean, it's just a hodgepodge of people. And if we went back to meeting in person, it would once again disrupt and change the group, much like it did when we first went on Zoom. As I said, I put out a weekly community calendar that also gives information about the research that's happening. And that's our website. If that's something that you're interested in, you can get our website address. Next slide. Now, ACA established this year, well, no, not this year established. This year, we renamed our Pre-Doctoral Scholars Program, the Lindy Harrell Pre-Doctoral Scholars Program for Research at UAB. This year, we contributed $50,000 to funding 2 pre-doctoral scholars. We have funded research grants at UAB, 21 grants since 2001, and they came to us and said what they really needed was money for students because they're trying to attract young, brilliant people into the field of Alzheimer's and dementia research. Because we need more minds, we need more thinkers to solve the problem of Alzheimer's disease, and we're really proud of what we've been able to do. And this has been the work of our junior board. Next slide. But the real services of what we do make such a difference in our community. We provide the Project Lifesaver bracelets in Jefferson County. In most counties, these are provided through the Sheriff's Department, but here in Jefferson County, we provide those bracelets. Currently, we've got 82 people who are wearing a Project Lifesaver bracelet in Jefferson County. The bracelets emit a radio tracking signal that can help locate someone if they have wandered. This is not a GPS device, it's a radio tracking signal. About 60% of people with Alzheimer's will wander, and those who do tend to do so repeatedly. So it is a very dangerous behavior. We had someone lost that had a Project Lifesaver bracelet on just last week, and I am so glad to say that Project Lifesaver in Alabama has 100% recovery rate. So it has worked when it has needed to work, but what we need is for people who are at risk to realize the risk of wandering and to call and to get a bracelet. Next slide. Oh, that's Mr. Thigpen. Now, Mr. Thigpen attended an adult daycare on an ACA scholarship, and he had a wonderful career in the military, but when he got home from the military, he went back to shining shoes in downtown Birmingham. And as he developed Alzheimer's disease and was unable to do that, he would forget he was unable to do that, and he'd go out and wait for the bus. His wife would catch him on the bus several times, and so the Project Lifesaver bracelet really made a difference for him. Next slide. Giving hope through adult daycare scholarships. We have had a really hard time with our adult daycares since COVID, of course, because it shut them all down. Before COVID, we had 79 people who are attending adult daycare at 7 different centers in Alabama. And today we have got 59 people who are attending 5 centers. So 2 of our centers have not reopened. We hope to get back to our pre-pandemic numbers of people, but right now there's just a lot of people who are still staying at home. All of the adult daycares, there's 100% vaccination rate. They are wonderful programs that provide supervision and care and camaraderie throughout the day. There are also programs called respite programs that are for 4 hours a day. And those can be very beneficial, particularly for people in the mild to moderate stages of the disease. We have lists of the adult daycare centers and the respite programs on our website, as well as an application for adult daycare. Next slide. It's just people having fun at daycare. Next slide. We provide art and movement classes for the daycares because having engaging, enriching activities is so important for the people that attend. Next slide. Right now, there are 169 people throughout Central Alabama who receive a case of continence products delivered to their door every month. This means so much because 72% of the people on this program have incomes that are less than $1,500 a month. So a case of continence products makes a real difference in terms of helping them extend their income for the month. Next slide. While our daycare centers were shut down, were shuttered, we started a program to provide insure. This is something we've known was needed, and we've just never had the funds to start the program. But right now we've got 116 people who are receiving a case of insure, again, that's delivered to their door each month. And we've just gotten great feedback from being able to provide that nutrition for families, because again, it's very expensive for families on a limited income. To combat isolation and loneliness during the pandemic, we've provided robotic pets, robotic cats and dogs, and they are wonderful. They're really wonderful for the whole family. If you touch them, they move. The cat purrs and rolls over. I'm a dog person, but I got to say the cat's a little bit better. Another thing we've done is provide activity packets that we mail out every week to families. That provides some puzzles, pages of jokes, artwork to look at and think about. You know, they're themed every week, and it's been a real lifesaver for families who are very isolated and need that kind of support. Next slide. 100% of the money that we raise stays in Alabama to help Alabama families. And we have low overhead, and 89 cents of every dollar funds the services, education, and research that we provide. And my final slide is our contact information, and it's got my email address there, mpiggott@alzca.org. And as I said, we're here. If you don't get me, you'll get somebody else here in the office, Vance Holder, and either one of us would be happy to talk with you and answer your questions. And if you are out and about tomorrow early, at 9 o'clock will be ACA's annual meeting at the Vestavia Hills Library in the Forest. That's located on Highway 31 in Vestavia. And we'll have a program in our candle lighting service, and it's just going to be a good morning for reflection. We'll have a light breakfast at 8:30, and the program will be from 9 to 10. Thank you so much, and I want to thank M4A for everything that they do. They are just such an incredible resource for this community. And the best thing about the folks at M4A is they're always looking for what next. What next can we do to fill a need in the community? And that's a great attitude for an agency to have. So they're great partners to have in the community. Thank you so much.
Thank you, Miller. And we could literally say the same exact thing about ACA. I mean, the work that you guys do and have done, obviously, for this long has been incredible, and it's changed numerous and countless amount of lives. But we love partnering with Miller. We do different initiatives, like she said, even at our agency with our dementia friendly initiative, where we train first responders. And Miller is always so supportive of that, especially when we have some of the larger events with that program. And like she said, a lot of people, probably with ACA, they probably don't know who ACA is. They probably don't know who M4A is, but we definitely find that a lot of people don't know what Project Lifesaver is. And I can't tell you the amount of times that I watch the news, I see on Facebook missing persons. And it's just, that's something that definitely needs to get out to the communities, that Project Lifesaver is such a great program, and oftentimes low or free cost, across the country. So that's a great program for you to take back and tell your neighbors, your loved ones, your family, to make sure that that's something they can check into. And again, thank you, Miller, for the kind words. Thank you for joining us. I see there that you've just responded, but so we had some positive feedback from the viewers. And again, if you have anything that you'd like to ask Miller, feel free to do that now. You can drop that in the chat feature. You can also drop it in our Q&A. Of course, if you're on our Facebook feed, you can drop a comment there. Jennifer, do you see any? I don't know if you've checked the Facebook to see if there's any questions on there or not.
There's not any.
Okay. All right. So as a reminder, let me go back to, we are giving away, I'm not going to spend too much time on M4A today because we are getting close to time, and for good reason, because that was a lot of great information that Miller brought us, and is something that we all need to know about and be refreshed on daily. So as a reminder, we are giving away a gift basket courtesy of our friends at 101 Mobility. They're located in Birmingham, but they cover the entire state. They build things like modular ramps. They can install grab bars, things like that. And they are, I believe they're the preferred provider just for some of the organizations across the state. So the way we're going to do that is we're going to run a report and see who all attended today. Preferably, we would like for this to go to a family caregiver, since we are acknowledging National Family Caregivers Awareness Month, as well as Alzheimer's Disease Awareness Month. But we will be reaching out if you, hopefully, whenever you signed up to RSVP for this event, you included your contact information. But if we can't get a hold of you, we will be reaching out, doing another random pick to see if we can select a winner here. So hopefully, may the odds be in your favor, or whatever the saying is, and we'll be drawing for that probably by, I would say, by the end of the week or the first of next week. So if you want to get in on that and you didn't include your contact information, definitely make sure you reach out to Panda, Panda, at M4A. That's M as in mom, the number 4A as in apple.org, and we'll definitely get you in the drawing there. So quickly, just a little bit of information about M4A and who we are. As Miller said, we cover various regions kind of across the greater Birmingham region, as does ACA, but we have a network of agencies on aging across the state. As you see there, we cover all 67 counties. There's 13 in total, and we're right there in almost the middle of the state in the Alabaster region, but we do provide services for Blount, Chilton, St. Clair, Shelby, and Walker, as well as Jefferson County for our senior employment program. In general, our statement for our agency is to empower individuals, people living with disabilities, and their caregivers to self-advocate, as well as live independently and safely in the communities of their choice. And to put it simply, our agency's motto is assisting all ages at all stages. We are really what we consider to be a one-stop shop, or a good starting point. If you're looking for some type of assistance and you don't really know where to turn, we're really a good organization to start with, because if it's not something that we provide in-house, we can more than likely connect you to a resource within the community that can help with your need. The way it starts, we have what's called an Aging and Disability Resource Center, or ADRC. And when you contact us via phone, in person, on our website, we will reach out to do what we call is a full benefit screening, to make sure that we kind of see what types of services that you might be interested in or are eligible for, and make sure that we get those resources to you. If you're listening to us from the other side of the state, maybe Huntsville or Dothan, Mobile, you can call that number there you see on your screen, 1-800-AGE line, and you'll be connected to your local area agency on aging that covers your area. Okay, again, I mentioned online. So if you would prefer, rather than call or come in person, if you would prefer to send a referral in digitally through our website, you can do so by visiting www.m4a.org/referral. And that will take you directly to a page where you can fill out information on the person, whether it be yourself or a loved one or a colleague or any of the above. You can fill out information and we can get in contact with you as soon as possible. We have several programs that range from caregiver support services to medication assistance to insurance counseling, legal services, elder abuse prevention. I need to mention that we've actually got an event on November the 30th. I believe, Jennifer, correct me, is it 10 to 2?
It's 11 to 2.
11 to 2. Formerly the Knollwood Assisted Living Facility in Montevallo, we're actually looking to place an elder justice center in that facility. And so we're having an open house for the community to come learn more about that. That's on Giving Tuesday, to kind of listen to kind of what our plans are there and see how you can get involved. So we have different initiatives. Miller was not lying when she said that we've got especially certain staff members in our agency who are always looking to find new initiatives, find new things to help, provide the assistance to the communities that we serve, because we know that it's such a needed thing in different facets of life. So we're always looking to add more grassroots programs, as well as funding opportunities so that we can help the community. Now, we'll add too that these are some of the programs that are unique to M4A. I did on the previous screen, there were some other services, but the Panda Project, one of the projects that co-hosts this program, Coffee Break, Miss Jennifer is the director of that program. We also have the Dementia Friendly Initiative, Living Well Alabama. We have a critical needs fund that you can donate to, tax deductible, to be able to provide emergency assistance. We have needs that come to us all the time throughout our communities, and that makes it so that we can have that opportunity to help provide that critical need in that such a critical situation. We also have a community service project we call AIM, which links volunteers with those in the community who are looking to, if they need a wheelchair ramp, or if they need grab bars, handrails, things like that, we look to provide that by way of volunteerism, and you can also donate to that cause as well. We are on social media, primarily on Facebook and YouTube. We do have a Twitter and Instagram. We're not very active there, but we're definitely active on our Facebook page. I think we have probably 5 or 6 pages. I know that there's a Panda page, there's an M4A page, an Alabama Cares page. So we have several different pages that you can visit, but definitely check out our M4A page in particular. That's the Middle Alabama Area Agency on Aging. And when you obviously follow that page, we definitely share stuff from some of the other pages. And that's a good way to stay connected on what's going on, current events, initiatives, things like that. Also, when you go to our website, you can scroll to the bottom and join our newsletter. Our marketing director does a great job of sending out an email weekly on things that are happening in our region, initiatives that we have going on. If there's other things that are going on within the community from other organizations like ACA, we put that information in the newsletters to make sure that we get it out to the public. Here is our contact information. Again, we're located in Alabaster. We're right across the road from the Saginaw Post Office, which is between Calera and Alabaster on Highway 31. And there's our numbers as well as our website that you can call, visit, swing by and check us out and see how we might be able to help you out. And we are always open to speaking as well. So if you've ever got your own initiative, especially for those who are joining us who may be a part of an organization yourself, if you're ever looking for speakers for your initiatives, we're always welcome to do that as well. As far as coffee break goes, we will not be having a coffee break next month, of course, with the holidays, but we're tentatively planning to jumpstart 2022 in January with a new year of coffee break initiative. So If you have a topic suggestion, and again, if you want to get in on that drawing, please, if you didn't put your contact information in the initial RSVP, you can provide that to panda@m4a.org, or again, Facebook message us on Facebook, or you can again call us and let the receptionist know that you want to put your name in for the drawing for the family caregiver basket, and we're probably going to be drawing for that either later this week or first of next week. So that's all that I have for the coffee break for this round for this year. And we again couldn't have been a better speaker to close the year out on with such an important month. I know that there's various initiatives and causes that are represented in November, but Alzheimer's awareness and family caregiver awareness are definitely two of the top ones that we always want to make sure that we show some acknowledgement to, because that's a task that many people take on every day. Numbers are staggering, and we can't thank the caregivers enough, because you're truly a hero. So thanks again, and we hope that you enjoyed Coffee Break. We'll have this video up posted on our YouTube channel if you care to share it with a family member, friend, neighbor. And we should have that up probably by the early next week at the latest. So we thank you, and we look forward to 2022's Coffee Breaks.